Thank you, Devin. And if you are someone who has chronic swelling to one or both extremities, you may have a lymphatic disorder. And here to tell us more about this is Nurse Christina Paris. Thanks for joining me this morning.
Hi, good morning. Glad to be here.
Yeah, always a pleasure. And you know, we're here. It's November. My goodness, where do the days go?
Yeah, I know it does.
By.
And now we're getting that darkness. We'll have to talk about that sometime
Exactly,
soon.
we will. But today we're talking about lymphatic disorders. So
right.
The lymphatic system and what is the main function of it?
Yeah, so the lymphatic system has a lot to do with our immune system, actually. So the organs that are involved in this is the thymus, the spleen, and bone marrow, which are essential for production of lymphocytes, which are your white blood cells that help fight infection. There's also vessels and lymph nodes. And so there's different types of, we can have swelling from different things. You can have it from congestive heart failure, from too much sodium intake. Women who are pregnant will just have swelling to their legs. Sometimes injuries, can too. So two of the big ones are lymphedema and lymphadenopathy.
Oh, wow.
Okay, so lymphedema is swelling, so that's fluid buildup in the extremities. And then lymphadenopathy is just your swollen lymph nodes that you'll feel like in your neck or under your armpit.
Wow.
But we have lymph nodes everywhere throughout our body. We have a lot of them in our belly. We have them behind our knees,
and so they can
in our
swell.
arms. And they
pretty
can
much anywhere then.
And that fluid can back up. And so, so then we get the swelling.
Well, that is rather neat. So are there common disorders that can occur with this lymphatic system? Right.
There are those two that I talked about, the lymphedema and lymphadenopathy, but you can also get lymphoma, which is a type of cancer. So, and that can come from, reoccurring infections too, can cause that, your lymph nodes to swell as well. And it's actually quite timely because many people who have breast cancer, and we know last month was Breast Cancer Awareness Month, it's often a complication that kind of goes along with breast cancer surgeries.
Interesting. So how is it treated or prevented if we can avoid this?
Right. So, the big thing is identifying it first.
Right.
So you're going to have swelling. You'll have swelling to your arms. You'll have swelling to your legs. Your legs might feel heavy. Your extremities might feel heavy and not even look swollen. And so, or, like we've talked about the lymph nodes under your arm. You're going to have, you might have restricted motion because it's so heavy, and you can have some hardening or thickening of the skin as well. And then, thank you. You had the prevention. We'll go back to that slide real quick. So prevention tips, of course, avoiding blood pressure cuffs or IVs or anything on the side that's affected. So if you've had breast cancer and you're concerned that you're at risk, on the side where you had the tumor or whatever surgical procedure done, you want to try to avoid blood pressure cuffs on that side. Protecting the skin from cuts or scrapes or burns or insect bites, because you can get something called cellulitis. It's an infection in your skin, and then that often can lead to lymphedema. And then and exercise programs, just overall staying healthy, maintaining a good weight, just those kind of things can help prevent it. Once you have lymphedema, you can't get, it's permanent. So what the big thing is going to be managing it. So they'll do things like complete decongestant therapy. That's kind of the gold standard. Manual lymphatic drainage. So it's a type of like a deep tissue massage on that area to try to manually drain those swollen things. A lot of people will have compression dressings. You'll see them on the full arm or the legs if needed. Getting into an exercise program too. And then good skincare, especially if you're a diabetic. You want to make sure that you're maintaining really good skincare, putting lots of lotion on, because they start to get neuropathy. You don't know that you've got a cut in the skin, plus just the added blood sugars can irritate the blood vessels, and it just overall prevents wound healing. And so if you have slow wound healing, you're going to be at more risk for like cellulitis. And then in worst case, they'll do surgery.
Okay.
But
So there's options here. There's lots they can do or try to help to
Right.
once you have it, and even preventative, of course, as well.
Right.
That's the ideal.
Right. And I was reading about, I guess that you can actually, if you're going to have a surgery and you think you're at risk, because I guess a lot of this happens post-surgical too, not just for breast cancer, but any kind of surgery, that if you go to a lymphedema specialist, so there are physical therapists that they specialize in lymphedema, they can help you understand your risks for getting lymphedema post-surgery. And so that's kind of a type of prevention, because then you're aware, maybe you'll start doing some things and they can help give you some guidance. But anytime, again, you feel like your arms or legs are feeling heavy, you're having swelling, anything like that, redness, warmth to the skin, go in and talk to your doctor.
Well, always, that's a good advice, and thanks for coming on and talking about this lymphatic disorder.
That's right.
There we go. New words this morning. But thanks for tuning in. Yeah. We're going to be right back with your morning dose of What's Trending.